This is a presentation on the HM1 September Bibliography for 2017, and what I'm going to do is break down the SSIC codes for all the instructions that you'll find on that bibliography. So first off, I want to start by talking about what an SSIC code is, a Standard Subject Identification Code. So all your instructions, they are labeled a specific way for a reason. Any instruction that is a 6,000 instruction has to do with medicine and dentistry. That's its subject grouping, that 6,000. But these numbers break down even more. So like I said, that 6 right there, that means that this instruction has to do with medicine and dentistry. If we go into what's called the primary number, right, the 6 is its grouping, medicine and dentistry. This 2, the primary number, that means that that instruction has to do with preventative medicine. Our secondary number, right, so we add this 2 right here, right, this has to do with communicable disease. So this instruction right here, 6220, it still has to do with preventative medicine. This 2 still means preventative medicine in the primary, but the secondary number, this means communicable disease, right? So this would be an instruction on how to prevent communicable disease. And then the tertiary number, this 4, that designates it to tuberculosis. So the tuberculosis instruction, 6224.8, well, the 4 means tuberculosis. Tuberculosis is a highly communicable disease. That instruction is focused on the prevention of the spread of tuberculosis and the policies we put in place for that. So that's why it falls under preventative medicine. And then, of course, that's a medicine instruction. So that's how they go about labeling the instructions by the SSIC codes. So there are 14 numerical subject groupings for your SSIC codes. So any instruction that is 1,000, that has to do with military personnel. 2,000 telecommunications, 3,000 operations and readiness, 4,000 logistics, 5,000 general administration, 6,000 medicine and dentistry, 7,000 financial management, 8,000 ordnance, 9,000 ships design, 10,000 general material, 11,000 facilities and activities, 12,000 that has to do with civilian personnel, 13,000 that's going to have to do with aeronautical, and then 16,000 that's going to have to do with Coast Guard missions. Now, it's really probably not worth your time to memorize all of these. Very rarely on our advancement exams for the hospital corpsman rating are we going to be asked about aeronautical things or instructions that have to do with ship design or anything like that. The ones I typically try to focus on is anything that falls into my 1,000 series, anything that's going to fall into the 5,000 series, and anything that falls into the 6,000 series. And if you look at the bibliography, almost all of the instructions are going to fall within those 3 numerical groupings. So it is worth knowing that your 1,000, that will always do with military personnel, 5,000, that's going to be your general administration, and then 6,000, that's going to be medicine and dentistry. The next thing I want to do is start talking about some of the primary numbers in these 3 groups we talked about in the 1,000, 5,000, and 6,000 series. Starting with the 1,000 series, military personnel, some of the primary numbers worth knowing might be the 1,300, right? 1,300 to 1,399, assignment and distribution. The 1,600, performance and discipline. 1,700, morale and personal affairs. The 1,300 instructions we have on this bibliography is only going to be the 1,300.2 alpha, the EF&P and suitability screening. Our 1,600, we've got the eval instruction, 1610.10 delta evaluations. And our 1,700, we've got 1,700.10 M, Sailor of the Year program. We've got the 1,720.4 alpha, suicide prevention. And then the 1,752.4 Bravo, the sexual assault prevention and response instruction. Moving on to our 5,000 series, general administration. Well, if we stay with that 50, that's just going to be general. If we go into 5,100, that's going to have to do with safety and occupational health. Anything in 5,200, that's going to be management of programs. 5,300, that's general manpower and personnel. 5,400, that's organization, functions, and status. We'll get into these a little bit more here. The instruction we're going to find on our bibliography that falls under 50,000. Well, that's going to be your BUMED Inspector General Inspection Program, 5040.2 Charlie. Our 5100, we've always got the 5100.19 Echo, the Navy Safety Occupational Health Afloat Program, and that one is a OpNav instruction. And going on to 52, that's going to be management of programs and remember, the 5 still means general admin, so programs that have to do with administration. So the instructions that we have that are going to fall under the 5200 on this bibliography are going to be our 5215.17 directives. We're going to have the SecNav manual 5216.5, our correspondence manual, and then moving on to our 5300s here, we've got deceit and affairs, right, 5360.1. And you might be wondering, well, why does this fall under general manpower, personnel, and admin? Well, the deceit and affairs is mostly dedicated to, how do, all the administrative things that happen with funerals and the remains of the deceased. So that's why it falls under this SSIC. And then we have our 5370.2, that's fraternization. And then moving on to our 54, we've got the 5450.15C, the Chief BUMED Organization. So the organization of the office of the BUMED, of the Bureau of Medicine and Surgery, and that's why it falls under this 5400 organizations, functions, and statuses. All right, now we're going to move on to the most important SSIC codes we got to know, the 6000 series, medicine and dentistry. Starting with the 6000, right, 6000 through 6099, that's going to be any instructions involving general admin as it pertains to medicine and dentistry. 6100 through 6199, physical fitness. 6200 through 6299, a very important one, preventative medicine. Always a lot of preventative medicine instructions on our bibliography, and a lot of preventative medicine in our readings in the Corpsman Manual. Or 6300 through 6399, general medicine. Our 6400 through 6599, that has to do with special fields under medicine and dentistry. Our 66, that's specifically to dentistry. And then 67 through 6877, that has to do with equipment and supplies. So let's get into these a little bit more. Well, actually, before we do that, typically, and I'll talk about this on the next slide as well, I try to memorize these fields right here, okay? I try to memorize all these primary numbers, that anything that's just 6000 is general admin under medicine. Anything that's 6100, physical fitness. Anything 62, preventative medicine. And like I said, this is a big one. Always a lot of instructions on preventative medicine. 63, general medicine. 65, special fields. 66, dentistry. 67 through 68, equipment and supplies. And the reason I do that, if you know this, you're going to be able to make these instructions to where they're not just random numbers, or make it to where you don't even have to memorize every digit in the instruction. If you got a question that asks like, hey, what instruction can I find guidance on tuberculosis, and you know that the tuberculosis instruction has to do with preventative medicine, well, a lot of times your options, they're only going to give you 2 options that are an instruction labeled 6200 something. You'll have like, SecNav instruction 6224 0.8, which is your tuberculosis instruction. You'll have 62.3 something, and then you'll have other instructions like 5100 or 67 something. You know what I mean? Just knowing that tuberculosis would be labeled in the 6200s. If you can't memorize all the digits in the number, or in the instruction, you'd at least be able to narrow it down to 2 reasonable choices, and you'd have a 50-50 shot. And sometimes you can narrow it down to 1 reasonable choice just by knowing this and not having to memorize the entire SSIC code for that particular instruction. Okay, so let's get into these a little bit. Let's see what instructions in our bibliography are going to fall under these primary numbers. So right away in our 6000, our BUMED instruction 6010.13, that's our quality assurance instruction. And that instruction is all about the administration and the administrative guidance on how to run a quality assurance program in a healthcare facility. And then pregnancy, the pregnancy instruction, it falls under 6000.1 Charlie, a OpNav instruction. And the reason that one falls under general admin, because it's not necessarily how to do medical care for a pregnant service member. It's more about the admin. When do the uniforms change? When is the service member going to be offered BAH and all, and everything to do with returning to full duty and all that stuff? It falls under general admin. 6100 physical fitness, where we're going to find the deployment health assessment instruction on that. OpNav instruction 6103 alpha, because that's all about making sure somebody is good to go, physically fit after before and after deployment. Our PHA 6120.3 alpha, and now this one isn't on the bibliography for this round, but it is in the Corpsman manual, so that you got to remember, just because an instruction isn't on the bibliography, if it's referenced in your Corpsman manual, they can still ask you about that instruction, and I think it's an important one to know. So periodic health assessment, think about what we do on the periodic health assessment. We're looking to make sure somebody's individual medical readiness is good to go, right? Making sure they're, essentially that they're worldwide assignable, that they're deployable. So we're going to make sure that they are physically fit to carry on the duties of the job. And then our OpNav instruction 6110.1 Juliet, your PRT, right? Your PRT, physical readiness. So your physical readiness test instruction, that's going to fall under 6100. All right, moving on to preventative medicine. So in preventative medicine, we're going to have BUMED instruction 6220.9 Bravo, hospital-acquired infections, because again, this is one of those instructions where we're trying to look at how we go about preventing and what we do about this on the preventative medicine side of the house. 6220.12, this is our manual actually. This is the Navy Marine Corps Public Health technical manual, and this one has to do with medical surveillance and reporting. What that means is it's this instruction about whenever we get a disease that needs to be reported to Navy Marine Corps Public Health, this is how you go about it, and it lets you know which ones are that. So that's why that falls under preventative medicine, and that's why we have this secondary 2 right here for communicable disease, because a lot of those diseases that we have to report, the reason we do is because they're highly communicable. And then our BUMED instruction 6230.15 Bravo, immunizations, right? 6 medicine, 2 preventative medicine, 3 has to do with chemoprophylaxis. Well, that's what an immunization is. We give you a chemical, right, that's going to induce immunity, so you're immune to that. It prevents that disease. And then we've got the Navy Marine Corps Public Health Manual 6250.1, the Malaria Prevention and Control Handbook. And then we also have 6280.1 Bravo, Regulated Medical Waste. All right, let's move on to 63, General Medicine. In General Medicine, we've got our 6300.19 6300.19, our primary care instruction, and we've also got the 6320.3 Bravo, medical dental care for eligible personnel. Special fields, we've got 6440.5 Charlie is our HSAP, our health service augmentee program, and think about what this instruction is about, right? This instruction is about how we go about augmenting people to the FMF, right? How people who are working in MTF go from, get put on HSAP duty, get augmented to an FMF unit. Well, that's considered a special field, so that's why it falls under that 4 right there. They go from just a typical MTF type of billet to a specialized field, into an potentially amphibious billet. So like I said, when preparing for the advancement exam as it pertains to, breaking down the bibliography, or preparing for when they ask what those questions, because it always seems to get like 5 or 6 of them, like, hey, what instruction is this? And it just lists the numbers. The way I prepare for that is, first, I make sure that I know those primary numbers, especially with anything in the 6000 series. Everything medicine and dentistry, you should know those primary numbers. So like we said, 6000 is general admin. So right right when the test starts, I grab my scratch paper and I write 6,000 general general admin. I go 6,100 physical fitness. I write 6,200 preventative medicine. I write 63 general medicine, 64 special fields, 66 dentistry, 67 equipment and supplies. So even when I get a question who is entirely unrelated to anything I read, or I just didn't get to that section, or it's it's a reference within a reference and it asks you about that instruction, if I know what field that falls under, a lot of times just having this, I can make an educated guess. And like I said, a lot of times you can narrow it down to a 50-50 shot. So after that, though, after I've listed this real quick, I then try to remember what instructions fell where from the bibliography. So real quick, I'll just write these all down, right? 6,000 general admin, 61 physical fitness, 62 preventative medicine, etc., etc. And then I'll just start plugging in the instructions, not worrying about the number or who even publishes them. So I'll go, hey, I knew in my 6,000, that's where my quality assurance instruction was. I also remember that's where my pregnancy instruction was. For my 6,100, I know that my deployment health assessment falls under there. I know that my PHA falls under there, and I know that my PRT falls under there. For 6,200, I know I had the hospital-acquired infection instruction on my bibliography, the medical surveillance and reporting instruction, the immunization instruction, and the malaria instruction, and on my regulated medical waste. For my 6,300 from the bibliography, I had my primary care. From 64, I had 63 again, I had medical and dental care eligible personnel, and for my 64, I had my HSAP program, and those are all the ones on the bibliography. And if there's anything else that's sticking in my mind just from reading from any reference within like the coordinator manual, I'd go ahead and write them down real quick as well, what those instructions are, where they fell. Then after I've done this, after I've just kind of done this real, data dumped, which section or which instruction fell under which section, if I can remember, then I'll concern myself with the numbers. Okay, so then I'll go through and write, the actual number next to the instruction if I can remember. But again, like I said, a lot of times you don't have to remember the number entirely. And then after that, if I have time, depending on how my study is going, I then try to make sure I know who publishes the instruction. So my quality assurance, that's, published by BUMED, by Navy Medicine. Pregnancy, that's an OPNAV instruction, okay? Deployment health, again, that's OPNAV instruction. And then the PHA, that's a SECNAV instruction. Our PRT, that's an OPNAV instruction. Your hospital-acquired infection, that's a BUMED instruction. And you find the ones that pertain, like any instruction that has to do specifically with Navy Medicine, like who's putting guidance out for Navy Medicine and how Navy Medicine needs to run things, that's going to be a BUMED instruction. And whenever it affects like the entire Navy, it's guidance that the whole Navy is going to be following. You'll see your OPNAV and your SECNAV instructions as well for that. 60 our medical surveillance and reporting. Well, that one is actually a technical manual from the Navy Marine Corps Public Health Center. Immunizations, that's a BUMED instruction. Malaria is also a technical manual from the Navy Marine Corps Public Health Center. Regulated medical waste is a BUMED instruction. Your primary care is a BUMED instruction, and then your medical and dental care for eligible persons, that's a NAVMED COM instruction, and HSAP is a BUMED instruction because, again, that's specific to personnel in Navy Medicine. And then, of course, all the other series we have to worry about, our 1000 series, right, our 1300, 2 alpha, the EFMP and suitability screening. And why this falls under general military personnel as well. Think about what this instruction is, okay? This is identifying, if somebody is suitable to be stationed in like a remote duty station. And EFMP is a way of screening family members and make sure they're suitable to receive if they need any kind of specialized care. And if they do, that can kind of affect the sponsors, the sailors' deployability, not deployability, but their assignability, what places they can be assigned to, depending on those resources. But anyways, that's a BUMED instruction. Our 1610.10 Delta, that's an BUPERS instruction, Navy Personnel Office, right? Our suicide prevention, that's an OPNAV instruction. Sailor of the Year, OPNAV instruction. And then sexual assault response and prevention and response, that's an OPNAV instruction. And then our 5000 series, the BUMED IG inspection program, that's a BUMED instruction. Our 5119 ECHO, the Navy Safety Occupational Health Afloat, that's an OPNAV instruction. Directives is an OPNAV instruction. Our correspondence is a Secretary of the Navy manual. Decedent Affairs is a NAVMED COM instruction. Fraternization, OPNAV instruction. And then the Chief BUMED organization, that is a BUMED instruction. Okay, I hope this helps you out. I hope this makes it to where your SSIC codes are not just random numbers. The resources on this is your SecNav manual M52 10.2. That's your SSIC code manual, and then of course I pulled all the instructions from the bibliography. Feel free with any questions, comments, or recommendations, or any requests. You can leave a comment right here on the channel, or you can feel free to email me as well. All right, and again, keep studying.